The Black Death was a massive plague outbreak that swept through Europe, Asia, and North Africa between 1347 and 1351. It was caused by a bacterium called Yersinia pestis, which lives in fleas that feed on infected rats. When these fleas bit humans, the bacteria entered the bloodstream and spread rapidly through the body. Once infected, people developed swollen lymph nodes called buboes, usually in the neck, armpits, or groin. These swellings were painful and filled with pus. Victims also experienced high fever, chills, vomiting, muscle pain, and extreme weakness. In many cases, the skin turned dark due to internal bleeding, which is where the name Black Death came from. There were three main forms of the plague. Bubonic plague attacked the lymph system. Septicemic plague infected the blood and caused organ failure. Pneumonic plague attacked the lungs and could spread directly through coughing and breathing, making it especially dangerous. Medical knowledge at the time was extremely limited. Doctors did not understand bacteria or infection. Many believed the plague was caused by bad air, divine punishment, or astrology. Treatments such as bloodletting and herbal mixtures were ineffective. Because cities were crowded, dirty, and filled with rats, the disease spread rapidly. Trade routes carried infected ships from port to port. In some regions, over half the population died within a few years. Smallpox was a highly contagious viral disease caused by the variola virus. It spread mainly through close contact with infected people, especially through coughing, sneezing, and touching contaminated clothing or bedding. The virus entered the body through the respiratory system and then moved into the bloodstream, where it multiplied and attacked multiple organs. After infection, symptoms usually began with high fever, severe headache, back pain, and extreme fatigue. Within a few days, a rash appeared on the face and spread across the body. This rash developed into fluid-filled blisters, then into thick scabs. When the scabs fell off, they often left deep scars, especially on the face. Many survivors were permanently disfigured. Some lost their eyesight due to infections in the eyes. Smallpox had a very high fatality rate. In many outbreaks, about 30% of infected people died. In some populations with no prior exposure, especially indigenous communities, death rates were much higher. The disease played a major role in the collapse of Native American populations after European contact. There was no effective treatment for smallpox. Care focused on keeping patients hydrated and preventing secondary infections. The major breakthrough came with vaccination. In the late 1700s, Edward Jenner discovered that exposure to cowpox could protect against smallpox. Global vaccination campaigns in the 20th century gradually eliminated the virus. In 1980s, smallpox became the first human disease officially declared eradicated. HIV/AIDS is caused by the human immunodeficiency virus, which attacks the immune system, specifically CD4 T cells that help the body fight infections. The virus spreads through contact with infected blood, semen, vaginal fluids, rectal fluids, and breast milk. Common transmission routes include unprotected sex, sharing needles, blood transfusions in the past, and mother-to-child transmission during birth or breastfeeding. Once HIV enters the body, it begins replicating inside immune cells. Over time, it destroys these cells, weakening the immune system. In the early stage, many people experience flu-like symptoms such as fever, sore throat, rash, and swollen lymph nodes. This stage may last several weeks and is often mistaken for a minor illness. After the initial phase, the virus enters a long latent period that can last for years. During this time, infected individuals may feel healthy, but the virus continues damaging the immune system. Without treatment, CD4 cell levels gradually decline. When the immune system becomes severely weakened, the condition progresses to AIDS, which stands for Acquired Immunodeficiency Syndrome. At this stage, the body becomes vulnerable to opportunistic infections and cancers that rarely affect healthy people. These include tuberculosis, pneumonia, Kaposi's sarcoma, and fungal infections. There is no cure for HIV. Treatment relies on antiretroviral therapy, which uses combinations of drugs to suppress viral replication. When taken consistently, these medications reduce viral levels to undetectable amounts, preserve immune function, and prevent transmission. Access to treatment has dramatically reduced death rates, but millions remain affected worldwide. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. It spreads through the air when an infected person coughs, sneezes, speaks, or sings, releasing tiny droplets that contain the bacteria. When another person inhales these droplets, the bacteria can enter the lungs and begin multiplying. After exposure, many people develop latent tuberculosis infection. In this state, the bacteria remain in the body but are inactive. The person has no symptoms and cannot spread the disease. However, if the immune system becomes weakened due to malnutrition, stress, illness, or aging, the bacteria can become active and cause disease. Active tuberculosis primarily affects the lungs, but can also spread to the brain, kidneys, spine, and other organs. Common symptoms include persistent coughing lasting more than 3 weeks, coughing up blood, chest pain, fever, night sweats, weight loss, and extreme fatigue. As the infection progresses, lung tissue becomes damaged, reducing the body's ability to absorb oxygen. Tuberculosis spreads easily in crowded and poorly ventilated environments, such as prisons, shelters, factories, and refugee camps. Poverty, limited healthcare access, and poor nutrition increase vulnerability to infection and worsen outcomes. Diagnosis involves chest x-rays, skin tests, blood tests, and laboratory analysis of sputum samples. Treatment requires a long course of antibiotics, usually lasting 6 months or more. Patients must complete the full treatment to prevent drug resistance. Drug-resistant TB strains have emerged due to incomplete or improper treatment. These strains are more difficult and expensive to cure and pose a serious global health threat. Despite available treatments, tuberculosis remains one of the leading infectious killers worldwide. Malaria is a parasitic disease caused by Plasmodium organisms that are transmitted to humans through the bite of infected female Anopheles mosquitoes. When a mosquito feeds on human blood, it injects parasites into the bloodstream. These parasites travel to the liver, where they multiply before entering red blood cells. Once inside red blood cells, the parasites reproduce and cause the cells to burst. This releases more parasites into the bloodstream, continuing the cycle of infection. This repeated destruction of blood cells leads to many of malaria's symptoms and complications. Early symptoms usually appear 10 to 15 days after infection and include fever, chills, sweating, headache, muscle pain, nausea, and fatigue. These symptoms often occur in cycles corresponding to the parasite's reproduction schedule. Without treatment, malaria can become severe and life-threatening. Severe malaria may cause anemia due to loss of red blood cells, low blood sugar, kidney failure, seizures, and coma. One form, cerebral malaria, affects the brain and can lead to permanent neurological damage or death. Young children and pregnant women are especially vulnerable. Malaria remains common in tropical and subtropical regions where mosquitoes thrive. Poor housing, lack of mosquito control, and limited healthcare access contribute to continued transmission. Prevention includes insecticide-treated bed nets, indoor spraying, and eliminating standing water. Diagnosis is done through blood tests that detect parasites. Treatment involves anti-malarial medications that kill parasites at different stages of their life cycle. Drug resistance has reduced the effectiveness of some treatments, making ongoing monitoring and research necessary to control the disease. Cholera is an acute bacterial infection caused by Vibrio cholerae. It spreads primarily through contaminated water and food, especially in areas with poor sanitation and unsafe drinking water. When people consume water or food containing the bacteria, it enters the digestive system and begins producing toxins in the small intestine. These toxins disrupt the normal balance of fluids and salts in the body. They force the intestines to release large amounts of water into the stool. This leads to sudden and severe diarrhea, often described as rice water stool because of its pale, watery appearance. Vomiting and leg cramps are also common. The most dangerous effect of cholera is rapid dehydration. A person can lose liters of fluid within hours. Without treatment, this leads to low blood pressure, shock, kidney failure, and death. In severe cases, death can occur within a single day. Cholera outbreaks often occur after natural disasters, conflicts, or infrastructure breakdowns that damage water systems. Refugee camps and overcrowded urban areas are especially vulnerable. Poor waste disposal allows bacteria to spread easily into water supplies. Diagnosis is confirmed through stool testing, but treatment often begins based on symptoms during outbreaks. The primary treatment is oral rehydration solution, which contains the correct balance of water, salts, and sugar. Severe cases require intravenous fluids and antibiotics. Prevention depends on access to clean water, proper sewage systems, hand washing, and safe food preparation. Vaccines are available and used in high-risk regions. Although cholera is easily treatable, it continues to cause large outbreaks in areas with limited resources. The plague of Justinian was a major pandemic that occurred between 541 and 549 CE during the reign of Byzantine Emperor Justinian I. It was caused by the same bacterium responsible for later plague outbreaks, Yersinia pestis. The disease spread primarily through fleas that lived on infected rats, which traveled on ships and trade caravans throughout the Mediterranean region. When infected fleas bit humans, the bacteria entered the bloodstream and rapidly multiplied. Most victims developed bubonic plague, marked by swollen and painful lymph nodes in the groin, armpits, or neck. High fever, chills, vomiting, weakness, and delirium were common. In many cases, the infection progressed into septicemic plague, causing blood poisoning and internal bleeding, or pneumonic plague, which attacked the lungs and spread through coughing. Cities at the time were densely populated and had poor sanitation. Grain shipments stored in ports attracted large rat populations, allowing the disease to spread quickly. Constantinople, the empire's capital, was heavily affected. Contemporary reports describe thousands of deaths per day at the height of the outbreak. Medical understanding was extremely limited. Treatments included prayers, herbal remedies, and bloodletting, none of which were effective. Fear and social disruption were widespread. Many people abandoned cities and farmlands, leading to food shortages and economic collapse. The pandemic weakened the Byzantine Empire by reducing its workforce, military strength, and tax base. It contributed to political instability and limited Justinian's efforts to reconquer former Roman territories. The plague of Justinian is considered the first recorded plague pandemic and a major turning point in European and Mediterranean history. Measles is a highly contagious viral disease caused by the measles virus. It spreads through airborne droplets released when an infected person coughs, sneezes, talks, or breathes. The virus can remain active in the air and on surfaces for up to 2 hours, allowing it to infect people even after the infected person has left the area. After exposure, the virus enters the respiratory tract and spreads through the bloodstream to multiple organs. Symptoms usually begin 7 to 14 days later with high fever, cough, runny nose, red watery eyes, and extreme fatigue. Small white spots called Koplik spots may appear inside the mouth and are a distinctive sign of measles. A few days later, a red rash develops on the face and spreads downward across the body. The rash is caused by the immune system reacting to infected cells in the skin. As the infection progresses, measles weakens the immune system, reducing the body's ability to fight other diseases for months or even years. Serious complications include pneumonia, brain inflammation called encephalitis, severe diarrhea, blindness, and malnutrition. Young children, pregnant women, and people with weakened immune systems face the highest risk of death. Before vaccines were available, measles caused regular worldwide epidemics and killed millions. In isolated populations with no prior exposure, outbreaks were especially devastating. The measles vaccine, introduced in the 1960s, provides strong long-term protection. High vaccination coverage is essential to prevent outbreaks because measles spreads more easily than most other viruses. Typhus is a group of bacterial diseases caused mainly by Rickettsia organisms. The most deadly form, epidemic typhus, is spread by body lice. When lice feed on an infected person, they become carriers of the bacteria. The bacteria are released in the lice's feces and enter the human body through scratched skin or mucous membranes. After infection, symptoms usually appear within 1 to 2 weeks. Early signs include sudden high fever, severe headache, chills, muscle pain, cough, and extreme weakness. As the disease progresses, a dark red rash may appear on the chest and spread to other parts of the body. Confusion, delirium, and low blood pressure can develop in severe cases. The bacteria attack the lining of blood vessels, causing inflammation and leakage. This damages circulation and reduces oxygen delivery to organs. As a result, patients may experience organ failure affecting the heart, kidneys, and brain. Without treatment, death rates in major outbreaks have reached 20 to 60%. Typhus thrives in conditions of overcrowding, poor hygiene, and limited access to clean clothing and bathing. It has been common in refugee camps, prisons, and military barracks. Major outbreaks occurred during World War I, World War II, and other conflicts where populations were displaced. Diagnosis is based on blood tests and clinical symptoms. Treatment involves antibiotics, especially doxycycline, which is highly effective when given early. Prevention focuses on controlling lice through hygiene, clean clothing, insecticides, and improved living conditions. Although large epidemics are now rare, typhus remains a risk in areas affected by poverty and instability. Ebola is a severe viral disease caused by the Ebola virus, which belongs to the filovirus family. It spreads through direct contact with the blood, bodily fluids, organs, or broken skin of infected people or animals. Transmission commonly occurs during caregiving, medical treatment without proper protection, and traditional burial practices that involve touching the body. After entering the body, the virus infects immune cells and spreads rapidly through the bloodstream. It damages blood vessels and interferes with the body's ability to clot blood. This leads to widespread internal and external bleeding, fluid loss, and organ failure. Symptoms usually appear between 2 and 21 days after exposure. Early signs include sudden fever, severe headache, muscle pain, weakness, sore throat, and fatigue. As the disease progresses, patients develop vomiting, diarrhea, abdominal pain, and rash. In severe cases, bleeding occurs from the eyes, nose, mouth, and internal organs. Ebola causes intense inflammation and disrupts the immune response. This combination leads to shock, low blood pressure, and multi-organ failure. Fatality rates in major outbreaks have ranged from 25 to over 90%, depending on the virus strain and access to medical care. Diagnosis requires specialized laboratory testing. Early detection is critical to controlling outbreaks. Treatment focuses on supportive care, including intravenous fluids, oxygen therapy, and blood pressure management. In recent years, antiviral medications and vaccines have been developed, improving survival rates. Ebola outbreaks have mainly occurred in Central and West Africa. Rapid response teams, isolation measures, contact tracing, and community education are essential to stopping transmission and preventing widespread epidemics. Polio is a viral disease caused by the polio virus. It spreads mainly through the fecal-oral route, meaning people become infected by consuming food or water contaminated with the feces of an infected person. It can also spread through close contact with infected saliva. Poor sanitation and limited access to clean water increase transmission. After entering the body, the virus multiplies in the throat and intestines. In most cases, infected individuals experience mild or no symptoms. When symptoms occur, they often include fever, sore throat, headache, nausea, and fatigue. These early signs are similar to many common viral illnesses. In a small percentage of cases, the virus enters the bloodstream and reaches the nervous system. It attacks motor neurons, which are nerve cells that control muscle movement. When these cells are damaged or destroyed, muscles become weak or paralyzed. This paralysis is often permanent and can affect the legs, arms, or breathing muscles. If the muscles that control breathing are paralyzed, patients may require mechanical ventilation. In the past, devices called iron lungs were used to help patients breathe. Some individuals later developed post-polio syndrome, which causes progressive muscle weakness and fatigue decades after recovery. There is no cure for polio. Treatment focuses on physical therapy, pain management, and supportive care. Prevention relies on vaccination. Two main vaccines, the inactivated polio vaccine and the oral polio vaccine, provide strong protection. Mass immunization campaigns have eliminated polio from most countries. However, limited transmission continues in a few regions due to conflict, misinformation, and gaps in healthcare access. Syphilis is a bacterial sexually transmitted infection caused by Treponema pallidum. It spreads through direct contact with syphilitic sores during vaginal, anal, or oral sex. It can also be transmitted from an infected mother to her unborn child during pregnancy, leading to congenital syphilis. After entering the body, the bacteria penetrate the skin or mucous membranes and spread through the bloodstream. The disease develops in several stages if left untreated, each with different symptoms and health effects. The first stage, called primary syphilis, usually begins with a painless sore known as a chancre at the site of infection. This sore heals on its own within a few weeks, which often leads people to believe the infection is gone. In reality, the bacteria remain active in the body. The second stage, secondary syphilis, involves a widespread rash, often on the palms and soles, along with fever, swollen lymph nodes, fatigue, and muscle aches. These symptoms may also disappear without treatment. The disease then enters a latent stage, during which there are no visible symptoms. This phase can last for years. During this time, the bacteria continue damaging internal organs. In the final stage, tertiary syphilis, severe complications develop. These include damage to the brain, nerves, heart, blood vessels, eyes, and bones. Neurosyphilis can cause paralysis, dementia, blindness, and personality changes. Cardiovascular syphilis can lead to heart failure and aneurysms. Diagnosis is made through blood tests. Syphilis is curable with antibiotics, especially penicillin, when treated early. Untreated infections remain a serious public health concern. Typhoid fever is a bacterial infection caused by Salmonella enterica serotype typhi. It spreads through the consumption of food or water contaminated with human waste containing the bacteria. This usually occurs in areas with poor sanitation, unsafe drinking water, and inadequate sewage systems. After entering the body, the bacteria pass through the stomach and invade the intestinal wall. From there, they enter the bloodstream and spread to organs such as the liver, spleen, bone marrow, and gallbladder. The bacteria multiply inside immune cells, allowing them to evade early detection by the body's defenses. Symptoms typically begin 1 to 2 weeks after exposure. Early signs include persistent high fever, weakness, headache, stomach pain, loss of appetite, and constipation or diarrhea. Some patients develop a faint pink rash on the chest or abdomen known as rose spots. As the disease progresses, mental confusion, lethargy, and delirium may occur. Without treatment, typhoid can cause severe complications. These include intestinal bleeding, bowel perforation, widespread infection, and shock. A perforated intestine allows bacteria to spill into the abdominal cavity, leading to life-threatening infection. Diagnosis is confirmed through blood, stool, or bone marrow tests. Treatment involves antibiotics, which reduce symptoms and prevent complications when given promptly. However, antibiotic-resistant strains have become increasingly common, making treatment more difficult in some regions. Some recovered individuals become chronic carriers, meaning they continue to shed bacteria without symptoms. These carriers can spread the disease unknowingly. Prevention depends on clean water, proper sanitation, safe food handling, and vaccination in high-risk areas.